hard work, the kind of labor, the kind of effort, the kind of mehnat that the anesthesia team puts in to salvage the lives of patients. The efforts of all those anesthetists and critical care specialists who do this on a day-to-day basis. And believe you me, we are filled with nothing but gratitude for the countless number of hours that you put in without getting all the glory, without getting all the glamour, without getting all the appreciation that you truly deserve, without getting all the accolades probably that you truly deserve, where the patient or the attendant does not fully well know as to who is responsible for those patients living through, coming out of these ICUs, coming out in situations where probably without your efforts nobody would have come out. So I truly acknowledge and appreciate the efforts, and I make sure that I say this all the time, that the teams of anesthesia really deserve much greater accolades, much greater affirmations from all of us. Normally CMEs are not known to be this grand, this big, this glamorous and this profound, but congratulations that you made this CME very fine, very nice, and you have scaled up and taken the standards of this CME very nice. I would like to congratulate the anesthesia department, the entire department, the heads of the department, the head of the department anesthesia here, all the guests who have come from outside.
In 1 year's time, more than 1,600 pediatric surgeries have been done, which is a major accomplishment. And another point that I would like to highlight is that the department started doing neonatal surgeries, and they need a huge round of applause for that. Good thing I've realized about the department is that they never say no. They always take up challenges, and that should be considered as a major achievement for any department. Once you start take challenges and accomplish them, that is a big achievement in itself for any institution. Thank you, Professor Hina and your team, for all the work that you've been doing over these years, who have taken upon the mission to educate people about all the difficulties that are there in airway management, and this CME today is an accomplishment of that. And I'm sure all the academic deliberation in this CME workshop will prove to be quite beneficial to all the attending delegates. Thank you once again.
When we began planning the CME, we asked ourselves one simple but profound question. What is it that our emergency teams need most? And the answer was clear: expertise in airway management. Because in the chaos of trauma and emergency care, the airway is the very first frontier. It is often the first and sometimes the only chance we have to change the course of a patient's life. That is why we are here today. We are here because someone's father, someone's daughter, someone's loved one will be wheeled into our emergency bay struggling for breath. And in that moment, the only thing that will matter is whether we are ready. As you know, trauma remains one of the leading causes of preventable death in our region. We envision establishing a dedicated state-of-the-art trauma center and emergency medical services, something that will transform the way emergency care is delivered here. It is a dream not for ourselves, but for every patient who deserves the very best chance at survival. So once again, I welcome you all to the CME. May today sharpen our skills, deepen our judgment, and above all, renew our commitment to those who come to us in their most desperate hour of need. Thank you all.
In 180 seconds, we have to take care. We have to decide. Like things go wrong, once you take a normal patient, and within seconds, heart rate goes from 80 to 140 or 190. So you have to decide. And we are doing multitasking. We are listening to the tune of the monitor, At the same time, we are glued to the monitor, we are looking, we are thinking. So we don't have 6 senses, I think we have more than 12 senses. So intensive care unit will give you a very good satisfaction because you get the result there only. And if you are in trauma, you get the result there only because in 180 seconds you will see. Clear the secretions, go for head tilt, go for chin tilt, intubate or go for surgical intervention. So that is what airway difficulties mean. What this all means that airway management at the trauma bay. So it is so important.
Today's success is not the effort of one, but the spirit of many. A blend of vision, teamwork and passion. Together we not only shared knowledge, but also strengthened the collective resolve to make emergency airway management safer, smarter and more effective. As we conclude, let us carry forward the spirit of learning and collaboration, because every area we secure, every life we safeguard, it's a reflection of the excellence we aspire to achieve. Thank you all for your time, your energy and wholehearted participation. Jazakallah khair, and may we continue to grow, learn and serve together. Thank you.
None of the patient dies because you have not been able to intubate. It's all because of lack of oxygenation. On the grip of your hand.
And if you intubate a patient who's having a raised ICP, you also can lead to potential harms, and that can lead to brain herniation or further injury.
Laryngotracheal injuries are rare injuries but life-threatening injuries. They constitute less than 1% of all traumatic injuries, but the morbidity and mortality burden they carry is very high.
Craniomaxillary trauma represents includes any external injury to hard and soft tissue of head, face and neck.
What does inflammation causes? It causes edema. So a patient who comes to you initially with no edema probably will have enhanced edema as the day progresses.
This technique or this traditional method is associated with very high incidence of complications, however, as well as failure to secure the airway in the first attempt.
Submental route of orotracheal intubation involves the creation of an orocutaneous tunnel from the submental area to the floor of the mouth with endotracheal tube exteriorization through anterior floor of the mouth.
Any algorithm, we go through 4-step approach. The first step will be we will try to perform laryngoscopy and intubate the patient. If we fail, we call it failed intubation.
Little details behind the scenes. Every step taught us something valuable. We built in a day. We realized that an event of this scale isn't built in a day, but with days and nights of dedication, teamwork, and the guidance of our mentors. Working on this CME has truly been an unforgettable experience, one that taught me the meaning of teamwork, patience, and passion for learning. Seeing it all come together today is nothing short of rewarding. Lastly, I would like to thank my wonderful team, my colleagues, my seniors and juniors who worked tirelessly and made this event possible. Together, we didn't just organize the CME, we created an experience of shared learning and collaboration. Thank you all for being here and for making this day so special. Thank you so much.